Welcome again, everyone. My name is Delora Anderson. I'm an attorney. I'm also a business owner and health enthusiast. And recently, I've been able to combine my passion of business ownership and health and fitness by becoming an independent partner with Zenzino, a global health and wellness company. So I am super excited to host this event today because it is National Nutrition Month. We wanted to bring you some information that might very possibly save your life, or if not, at least improve the quality of your life. So with that, let's turn this over to Dr. Vel. Let me tell you a little bit about her. Dr. Velmalia Matthews Smith is a dual board certified oncologist. She serves as medical director for the Center for Cancer Care at Canton-Potsdam Hospital. She completed fellowship training in hematology oncology at Vanderbilt University Medical Center, where she was named Most Outstanding Clinician and was the recipient of the Ruth L. Kirstein National Research Service Award. She performed research on non-small cell lung cancers in African Americans, a study funded by the National Cancer Institute of the National Institutes of Health. Now, Dr. Vel is a member of the International Association for the Study of Lung Cancer, the American Medical Association, and the American Society of Clinical Oncology. She has served as an assistant professor at Wake Forest Baptist Health, written a number of publications, given presentations, and conducted research. Dr. Vel specializes in the diagnosis and treatment of cancer using chemotherapy and medically based interventions. Her practice focuses on medical oncology, including treatment of cancers common to the North Country, such as cancer of the lung, colon, and breast. Whew. Now, let me tell you what, that is not even the half of all that Dr. Velmalia Matthews Smith has accomplished. In fact, Dr. Vel, could you take a moment, tell us anything that you would like us to know about yourself that wasn't covered in your biography? And also, could you take a moment to tell us, why did you become a doctor?
Thank you so much for having me. Thank you for that beautiful introduction. I just pray there's more to come for my ministry in health and healing. I chose to go into medicine because I wanted to be a healer. I continue that mission today, and hopefully there's much, much more to come in my journey.
That is awesome. Now, we got on this Zoom today to be able to cover a very important topic. And this is actually a phrase that you coined, and we're going to be talking about the diet of disease. What's eating you? So I'm going to turn this over to you for a few minutes, and then we'll come back with some more questions. But could you please take a few minutes just to talk about the very powerful notion of the diet of disease?
Yeah, thank you so much. So I think that a lot of us understand that key to our health is what we're consuming. I think increasingly the medical community is becoming aware that many of the diseases, the chronic diseases that we see today, and the leading causes of death in the United States and across the world are diseases that are largely preventable. So we're talking about cardiovascular disease, which is heart disease. We're talking about um, diabetes. We're talking about cancer. We're talking about basically what is contributing to morbidity, which means not living in health, and then also mortality, which is the causes of death. And when we really consider that many of these diseases are preventable, the question is why? And I think most of us, myself included, many of our habits are habits of convenience. We are all very busy. We work very long hours, and we are eating what is convenient and what's easily available. And whether that is a diet that is a fast food diet or a diet that is basically on the aisles of the grocery store instead of the perimeter of the grocery store. And even when we are desiring to be health conscious, sometimes just being able to integrate those habits into our lifestyle in such a way that they are sustainable is a challenge for most of us. It's really just our diets are out of convenience, and unfortunately that convenience diet and those convenience foods are filled with polyunsaturated fats. They're filled with additional additives, and many of these things are cancer causing. They're causing our cardiovascular, they're leading and basically propagating heart disease. And so really I feel like, there's a scripture in the Bible that says my people perish due to lack of knowledge. And I think it's being knowledgeable about the foods that we're consuming, being knowledgeable that we can either consume things that are going to be healing to our bodies or consuming things that are going to be harmful to our bodies. I think most of us are comfortable with that concept, but I think in terms of how to make that sustainable, how to integrate those practices in meaningful ways that we can sustain for long periods of time, I think that's where the challenge is.
Wow, absolutely. And I've heard you and other doctors say before that medical doctors, they're not trained to prevent disease, they're trained to treat disease. Can you tell us a little bit about your perspective on that, and also your wellness and for-profit and nonprofit initiatives?
Sure. Thank you. I think I agree. So I'm an allopathic physician. So if your doctor, if the letters behind your physician's name is MD, that means they are allopathic trained. And so allopathic medicine is largely very science driven. And there has also, kind of as a consequence of that, been a strong emphasis on pharmacology. And when I was trained, and when most physicians are training in this country, we receive very little nutritional training. You may have a couple of hours in a class or two during your first couple of years of medical school, but everything that we're basically consuming or digesting around nutrition is basically what you're being told about nutrition. And there's just very little emphasis on nutrition. I think we are trained, obviously, to treat disease. I know personally that when I was in school, I was taught, okay, when someone has high blood pressure, you're trying to prevent a heart attack or you're trying to prevent a stroke, that there wasn't this concept that you could truly reverse disease. And although you're taught that yes, lifestyle changes can treat the disease, it's kind of like nobody follows that anyway. It's not going to work. So don't waste your time. Just write the prescription. And I also think in the modern era of healthcare, in our healthcare systems, healthcare is very expensive. It's a very expensive system in this country. And so in terms of the amount of time that your provider has face to face with you to really talk through what your challenges are, how difficult it is to basically follow these principles, that's very difficult to achieve in a 7 to 12 minute face to face encounter with your physician. I personally have had those challenges because I deal in cancer. This daily my patients are asking, doctor, what should I be eating? And I find that, in that visit where I'm attempting to focus on saving your life, meaning you're not dying from this cancer, I am very much having to focus on the allopathy of medicine. And I find that if I'm really wanting to delve into nutritional changes or dietary changes, that amount of time exceeds what I can accomplish in that encounter. And that led me to want to create other avenues to do these interventions. So I wanted to create avenues where I could educate communities about lifestyle interventions, about nutritional wellness, about using food as medicine and understanding the healing benefits of food when we are utilizing foods the right way. I also wanted to create a basically something outside of my practice where I can have those one-on-one meaningful functional medicine type of encounters with patients. And so I created a foundation that allows me to do offer those services as a not-for-profit. And I also have been trying to build my life coaching business on the side that allows me to actually do that, have those encounters outside of my regular practice.
That is why you were the first person that my husband and I reached out to when we learned about Zenzino. We were intrigued because of its test-based approach to nutrition, and also because of its goal to become the #1 preventative health company in the world. And although we're pretty healthy, I mean, we follow a completely alkaline diet that's plant-based, no meat, no dairy, no starch, work out 5 days a week. We thought we were good. But we found out with the Zenzino balance test that our omega-6 to 3 ratio was way out of balance. And first of all, we didn't even know that that was a thing we needed to be aware of. And I want to share this. I read in a Harvard Medical School journal this week, it said that chronic inflammation plays a central role in some of the most challenging diseases of our time, including arthritis, cancer, heart disease, diabetes, asthma, and even Alzheimer's. Can you take a moment to speak to the relationship of a high omega-6 to 3 balance and chronic inflammation?
Sure. So I'm gonna take a step back and even just when you think about your body, our bodies are literally fearfully and wonderfully made. And your body wants to be in homeostasis. So if we go back to ninth grade biology, it means that there is equilibrium. So your body wants to maintain its balanced state. It wants there to be a balance between inflammation and anti-inflammation, because you have to understand that there's a physiologic reason for inflammation. And the point of inflammation is that when our bodies are attacked, typically if we think about like an infection like a bacteria, the way that your body counteracts that, the way that your body defends itself against foreign invaders, is it activates all of these inflammatory pathways so that you can recruit this infection fighting cells. When I talk to my patients about it, I say your body has a military and your military has these soldiers. And the intent of the soldiers is to defend yourself against attack. And it's so that you don't die from infection. You don't die from this thing that is trying to actively harm you. And so we have these inflammatory pathways, and they are supposed to be there because they keep us alive. However, what's the problem is once that inflammation is gone, those cells they go dormant again and they just continue to circulate until needed. The challenge is that we are constantly consuming things through our diet, and we're constantly being surrounded things in our environment that are pro-inflammatory. Our body is seeing these things as toxic to us, and our bodies in response are activating inflammation. And there are many, many, many thousands and thousands of pathway, millions and millions, billions of cells in our body that are constantly engaging with the outside environment. And this, like I said, these are pathways that should be there. But if the pathway is constantly turned on and it never has an opportunity to go dormant, where inflammation subsides and your body can then heal from the inflammation that was present, then we're constantly inflamed and those pathways are constantly being activated. As a consequence of that, like in cancer, that constant injury over time leads to abnormalities, which are called mutations, that lead to the development of cancer. And this is a similar process is happening, for example, in the lining of your blood vessels, where this constant injury over time, where you haven't had an opportunity to repair this damage, and then it sets people up for heart attacks or strokes. And so when we think about these, is it's you can't think about your body doing something it's not designed to do. It's doing what it's designed to do. The challenge is it was not evolutionarily designed to be constantly under attack in the ways that our bodies are today. And so when you think about, okay, how do I stop this, right? How do I stop this constant inflammation or being too inflamed? And that's where a product like Zenzino comes into the conversation. It has to become a part of our dialogue. Number one, we have to be aware. If you're not aware, I say the most dangerous thing is what you don't know. And if you don't know what you don't know, then you're really in trouble. And so this is a situation is we can't see what's going on at the cellular level in our bodies. We have markers of that. We can see, we have blood tests, and that's the great thing about the Zenzino blood test is, gosh, we're all walking around. Everybody talks about heart disease as the silent killer, and it's like what the WHO is saying, it's inflammation. We're going beyond the disease itself and actually to the origin of the disease, which is this pro-inflammation that's constantly going on. And so the idea that we can actually test effectively across, like, literally thousands of miles and across countries, accurately assess what is actually going on inside my body so that I understand the degree of inflammation that is happening. And so the omega-6 pathways are actually pro-inflammatory, and there are others. So what the omega-3 is doing is it has the ability to actually counteract the omega-6s and actually reverse some of the inflammatory pathways that are being activated. And that's what's so powerful about this tool. It's a tool. How do I incorporate things that I can do every day? And beyond that, it's like, how can I prove that it works? Like, I know that what I'm doing is working because I can follow a blood test, or I can follow a CAT scan, or I can measure something. So this gives us measurable, um, a measurable tool by which to assess the effectiveness of an intervention.
Amazing. You know, I was over here taking notes feverishly while you're talking because now being an independent partner with Zenzino and really trying to spread the word about health and nutrition, I just am a student. And, you know, for the last 8 years for me and 10 years for my husband, we've been on this plant-based diet and telling everybody we know about it. I've started Facebook groups, text groups, sending out information and recipes to my friends and my family. I think we almost got kicked off our cruise when we were over in Spain back in December because we were telling people all the bad stuff they were eating. But we love Zenzino because it gives us an opportunity to share products with people that can really help them.
Mhm.
Whereas people might not be willing to stop eating meat, dairy, starch, and all the things that we stopped eating, they might be willing to take a supplement that, as you've described, could be very effective for them. So let me ask you this, and this will be my last question. With your thriving career as a medical director of a cancer center and the other wellness initiatives that you have, why did you decide to partner with Zenzino?
Oh my gosh. It's such a loaded question. You were just saying about, like, talk when you're talking to people. So I do a lot of self-talk about this. This is something I'm very passionate about. I would say the first time I actually um under really even thought about it, I was doing a fast. It was a spiritual fast. I had a life change and I needed to hear from God. And fasting for me has always been about sensitizing myself to the voice of God. And I decided to do a Daniel fast because my responsibilities at that point in my life were very heavy. And so in a Daniel fast, Daniel goes back to how the Bible told his children to eat, which was fruits, vegetables, grains, seeds, and legumes. And so I did that for like 41 days. And there were all these benefits that I saw in my life. And I was like, and so that kind of led me to start to read about things like veganism. And and I was fighting to maintain that lifestyle, fighting to maintain that way of eating. And what I found was, just as I would kind of get inundated, my day would be long or there would be stress, and I'm just trying to get to whatever I can get to feed my kids, or it just I just kind of gradually, my habits went back to normal. And this has happened to me several times over lots of years. So I have a unique understanding of how challenging it can be to maintain a certain eating patterns over prolonged periods of time. And so when you think about accessibility and longevity, because really it's what you can sustain that's going to have the biggest overall impact. And so if people are already taking supplements, people ask me every day these questions. And so when you understand that people are already taking these supplements, they already understand that they can be of value and why they're of value, then this becomes, the conversation becomes easier. It's like, there's a gentleman, William Lim. He does work on anti-angiogenesis and anti-angiogenic agents. We've used them in cancer. We use them to treat high blood pressure. Well, his whole work as a biochemist is about looking at the foods that are anti-angiogenic, and there are teas, for example, that are anti-angiogenic. So if I tell someone, hey, instead of drinking your soda, drink your tea, that's an easy step. Taking it in small bites, taking it in little pieces that you can actually easily incorporate and sustain for long periods of time. And to me, that's why the Zenzino supplements are so life changing. And I believe so wholeheartedly in nutrition and food as medicine, preventative health. I say the cancer I'm going to cure 100% of the time is the one that never happens. So it's very important for me for people to know, hey, what can I do so this never happens to me? And then what can I do so that this never comes back? We know that women in breast cancer, even if they reduce their weight by 10%, their cancer risk recurrence decreases. We know that if your diet doesn't have meat and dairy, you're less likely to have these cancers. So giving people tools to make those health choices easier, I think is just paramount. And then if you add that you can test and prove that it works, the scientist in me just sparkles and does happy dances.
Well, I tell you what, this has been absolutely amazing and so very informative. And if you all would like information about the Zenzino Balance Test products or even the business opportunity, you can just click on the link in the description of this video and you'll be able to request information. But you've seen me as an attorney all the way to Dr. Bell as a hematologist, oncologist. We're seeing people from all walks of life become a part of the business because a lot of people are health conscious now, and they're trying to also get their families to become health conscious as well, as we see these diseases becoming commonplace that are largely preventable. And so nutrition is a way that we can prevent some of the diseases that we're facing. So again, if you'd like more information, click on the link. We thank you so much for joining us for this Facebook Live event. Thank you so much, Dr. Bell, Dr. Velmalia Matthews Smith, for joining us today. And if you all do have questions in general, drop them in the comments and we'll come back and try to answer some of those questions. But if you like more information, submit the request on the link provided. Take care, everyone. And again, happy Nutrition Month.
Thank you for having me.
You're welcome. Thank you.